Okay, well, good evening. Welcome to our webinar on hip replacement surgery. My name is Louise and I'll be your host this evening. Our expert presenter is Associate Specialist Surgeon, Mr. Kumar Reddy, you can see on the screen. This presentation will be followed by a Q&A session. If you'd like to ask a question during or after the presentation, please do so by using the Q&A icon, which is at the bottom of this screen. This can be done with or without providing your name. Please note this session is being recorded if you do provide your name. If you'd like to book your consultation, we'll provide contact details at the end of this session. I'll now hand over to Mr. Kumar Reddy and you'll hear from me again shortly. Over to you.
Thanks very much, Louis, for the introduction. Good evening, everyone. So, a little bit about me, and I'm Kumar Reddy, and I work in Benenden as an orthopedic surgeon, and also I work at East Kent hospitals, and I'm currently the site lead, consultant site lead for orthopedic surgeons, and also a member of American Academy of Orthopedic Surgeons. And my interests always have been hip and knee orthoplasties, and also I do unicompartmental knee replacements. And in addition to this, I do arthroscopies, ACL reconstructions, and revision surgeries, including hips and knees in the NHS. And I'm one of the highest volume surgeons in the East Kent. I'm pleased to say that. And I do roughly approximately around 400 joints a year, which include hips, knees, revision surgeries, unicompartmentals, and also ACL reconstructions. That's my background. So I'm just going to brief my presentation today with regard to the hip arthritis and how we investigate what are the symptoms arising from hip pain and how we're able to diagnose what are the differential diagnoses and what types of hip replacements we do, and what are the bearing surfaces that would be best for our patients, and the supporting tools, and also recovery process and the risks involved with regard to hip replacements. Okay, I'm proud to introduce my colleagues who are on the board and who are always helpful, and they are very experienced in this field of hip replacement surgery, which include Alex Chipperfield, who is our MSc chair for orthopedics, and Mr. Dunnett, Mr. Matthew Oliver, Omar Yani, Raj Srivastava, and Raman Thakur. You've got an excellent team of surgeons with a lot of experience with regard to hip replacements. With regard to Benenden Hospital, we do approximately 290 joints who are private hip replacements in Benenden, which is next to Hoda Center, which they do about 300 a year. I mean, if you look at overall figures, we do about approximately 1,000 joint replacements a year, or even more this year. So it's a very high volume center, Benenden Hospital, and I'm proud to announce that our hospital has got, Benenden Hospital has got the outstanding CQC rating. So with regard to coming to the hip arthritis, what is osteoarthritis of the hip? It's a common disease affecting the joint in the body, which is a ball and socket joint. And the joint surfaces which are covered with smooth cartilage may get damaged, and it becomes rough, and the articular cartilage becomes gradually thinner, and eventually it turns out to be bone-on-bone arthritis, which can cause a lot of pain. And the other factors that contribute to the joint arthritis is high BMIs with morbid obesities, and injury. A trauma can cause arthritis, a previous dislocation or a fracture on the hip can contribute to arthritis and other conditions which include rheumatoid arthritis, gout, and also avascular necrosis, which can contribute to secondary osteoarthritis. Next is what are the common symptoms that one can see in case of osteoarthritis. Usually people complain of pain and stiffness with a limited ability to walk. And they often wake up at night because of the pain. And usually when you ask the questions like, do you have difficulty in cutting the toenails, putting the socks, tying the shoelaces, these are the common symptoms that people express that, doc, I have got difficulty in cutting the toenails and I can't get in and out of the car, forget about getting into the bath. I only have a shower these days. And all these symptoms you can come across in hip arthritis. And sometimes people get confused with the trochanteric bursitis. They always contribute, say that the pain is coming from the hip, and one has to, you need to ask a consultant who is examining you, and they will always examine you and find out whether the pain is coming secondary to trochanteric bursitis, which is an inflammatory condition, and also is inflammation of the tendon called the gluteus medius. So one should be able to distinguish whether it's coming from the trochanteric bursitis, which is a localized pain around the greater trochanter of your of your hip, either of the hips. And whereas arthritic pain is usually associated with marked stiffness of the joint, and people will have limited range of movements in the hip, and usually they describes as catching or cracking sensation in the hip, and weakness in the muscles because of the disuse uh, due to pain. Uh, and the treatment options of hip arthritis are mainly conservative and like lifestyle changes, pain relieving medications like paracetamol, non-steroidal anti-inflammatories, opioids, and in case of early to moderate arthritis, then a steroid injection can be helpful. This will also determine the diagnosis and also therapeutic value, because if following the steroid injection one has significant relief of symptoms, it definitely indicates that it is arising from the hip. If it is not, it would not make any difference. Usually it is very valuable when you got both hip and spine arthritis to distinguish between these two. And a walking stick would be beneficial, and special footwear also can be beneficial along with physiotherapy. If all the conservative methods of treatment fail to significantly improve your symptoms, then surgery comes into place, which would be a hip replacement surgery. And previously people used to do joint fusions. It is not advocated anymore um, because of the cumbersomeness to the patient. So joint replacements have given good results over the years, and people tend to do joint replacements these days. And with regard to hip replacement surgery, you can see 48% of the hip procedures are done within the independent hospitals in the UK in 2021. And approximately 84,000 primary hip replacements are being done in UK in 2021. And hip replacement surgery is the second best operation in the world behind cataract surgeries. And 96% of the patients are happy that they had this surgery performed. It's mainly getting rid of the pain, improving your quality of life, and getting back to your normal day-to-day activities. And out of 84,000, 60% average ages, and 5% of secondary to trauma that has contributed to the arthritis later on, and 90% of them are osteoarthrosis. And what is a hip replacement? Hip replacement is a surgical procedure As you all know, it is a ball and socket joint, and the joint is made up of two parts, which is the hip socket, which we call it an acetabulum, as you can see here, that is the socket, and you got the thigh bone, where you can see the femur here. So, and where we ream the canal of the medullary canal, and then we put in the hip replacement. That's what it is. And you get a ball on the top of it, which we put in a ceramic head or a metal head, as in this place. You can see a metal head. So this is what is the two damaged parts of the socket, and the ball are removed and they're replaced with an artificial socket along with a plastic liner, and also in the femoral stem that goes into the thigh bone with a modular head, either metal or ceramic. My preferred choice is a ceramic bearing on polyethylene socket, which it eliminates squeaking. If you put ceramic on ceramic, some of the patients can squeak and cause a loud noise, whereas the long-term survivorship of these ceramic heads is much longer when compared to the metal heads. The main reason for one to offer a hip replacement surgery is mainly to get rid of your pain and to improve your quality of life. And you need to have sufficient symptoms, significant symptoms arising from this. And also radiologically, the X-rays and MRI scans have to confirm, and they're consistent with moderate to significant arthritis in the hip. If the radiographs or MRI scans do not show any evidence of arthritis, we should be looking into other causes, what is contributing to the pain. Do I need a hip replacement surgery? The reason I've stated earlier, what are the reasons for one to have a hip replacement, and severe pain that is limiting your everyday activity. You find it hard to walk any distance without any significant pain. And if you're taking lots of painkillers every day, and again, there are quite a lot of side effects which can upset your stomach and kidneys in the long term if you're taking non-steroidal anti-inflammatories. You have moderate to severe hip pain when resting, either during the day or night, and there is increased stiffness and inability to bend and straighten your hip. And with regard to the types of hip replacements that we have got 10A WODAP rating, 10A star WODAP rating implants in Benenden Hospital. And we've got two types of implants. One is Biomed Zimmer, which is a taper lock, and G7 established shell, which I'll show you in a minute. So this is the Biomed acetabular socket, where we put in hydroxyapatite, which is like coating, and this is a type 1 collagen that goes into the socket, and this one bonds against the bone like a glue because of the hydroxyapatite coating. You don't have to put any cement. And again, in the thigh bone, as you can see, and we ream the canal into the thigh bone, and then you put in a femoral stem. Again, it is proximally coated with either porous coating or a hydroxyapatite coating, and this one goes into the thigh bone, and on top of it you got the neck, and you can attach the head into the femoral head goes on the top of it, and it articulates with the socket and the hip, which you can see. This is the hip joint, ball and socket joint. So, and one can either cement the hip, you can have cemented implants and uncemented implants. My practice has always been an uncemented total hip replacement, which I've been doing for the last 20 years. And when the bone quality is quite poor, then we tend to cement the stem rather than the socket, which we do a hybrid hip replacement, uncemented socket and a cemented stem. In addition to this, we also have got debut products like a coral hip replacement. Again, this one is, you can see the whole femoral stem is coated with hydroxyapatite, which is again a type 1 collagen, which encourages it to bond against the thigh bone, and the osseointegration takes place so that you don't have to use any cement. Again, on the top of the femur, you can put a metal head or a ceramic head, which is there, and this have got the long time better survivorship than the metal heads that you can see here. So these are the two differences that you can see. And all these implants have been time tested for the last 30 years, and majority of them, nearly 95% of them, the survivorship is a minimum of 20 years or more. Again, I tend to do for younger patients, less than 50 years, with this short stem hip replacement, mainly to conserve the bone. And also it makes anybody's life easier after a period of 20 years to revise this, because they're only proximally coated. It is much more easier to remove rather than a full stem that is going right into the thigh bone with the hydroxyapatite. So it's only the proximal coating, so it only bonds on the proximal surface. And that's why I do in younger patients, because at some point they would require some surgery. So I'm trying to be quite considerate to my colleagues who are going to do revision surgeries in the long term. Again, with regard to gait analysis, Justin Koch from Imperial has done several studies, and he has time and again proved that short stems have got better functional outcomes when compared to standard total hip replacements. Again, what is involved during a hip replacement, an operation? Approximately, the common questions I come across is, how long does the operation take? Normally about 45 minutes to an hour is the surgical time. And again, it includes your anesthesia and the recovery period, which may take up to 2 hours or so for you to get back to the ward, 2 to 2.5 hours in total. Majority of our patients get a spinal anesthetic with some nerve blocks. And also, if they don't want to hear any noises, people can be sedated. And the next question people ask is how long we're going to stay in the hospital. Majority of the time, with our expert physiotherapists input, and with our specialist nurses looking after the post-op care, and the rehabilitation is much quicker. Nowadays, majority of the patients stay about a day or two, and most of them go home within 2 days. They have their post-op x-rays, which will be checked, and they'll be discharged home. And again, they'll be seen in the clinic after 6 weeks. And if you got any problems between them, and usually they ring to the wards, who will bring it to the respective consultants' attentions who have done the surgeries, and they'll be on phone to you the very next day or so to talk to you about your concerns. So what is involved in during surgery? You just remove the damaged parts, as you can see on the slide, that it's a ball and socket joint. We take the cut from the neck, we take this ball off from the hip joint, and also the socket will be reamed to a press fit size, and we put in appropriate size of the socket. We got all the sizes available in theater. So we put the appropriate size, and then we either cement or do an uncemented femoral stem, depending on the surgeon who's used to cemented or uncemented hips. So I'm just showing you an example with regard to the hip replacements that we put in here. One is hybrid hip replacements, where you can see on either side bilateral total hips with all the cement mantle across the femurs, and also uncemented socket with a ball being attached. Again, you can see on the other side an uncemented, totally uncemented hip replacement with an uncemented cot established shell along with the polyliner, and also a femoral stem that is going inside the thigh bone. With regard to recovery from a hip replacement surgery, as I said to you earlier, about the hospital stay is about a couple of days at the most. Usually patients are allowed to walk as quickly as possible after surgery with the help of physiotherapists. The physiotherapists, we've got an excellent team who will be looking after the post-op patients, giving you the advice with regard to do's and don'ts, and initially discomfort in the leg and swelling of the feet. You'll get involved with the exercises given by the physiotherapist in order to strengthen the hip. And also they'll be advising you with regard to the do's and don'ts after surgery. I always tell the patients to use the crutches till they regain the confidence. Usually it is like learning to walk again after a hip replacement surgery. Once you develop confidence, which most of the patients do develop confidence, and majority of the patients within 4 weeks, they get rid of the crutches and they walk independently. And some may require a bit more longer to rehabilitate. With regard to recovery from a hip replacement to going home, we only let you leave the hospital once every one of us are happy that it is safe for you to do so. Usually they provide you a frame, and majority of the patients do get a couple of crutches so that you can fully weight bear and walk on it. You'll be also shown how to safely go up and down the stairs. And after about a week, most people can walk independently with the sticks. And 2 weeks, I advise people to take some painkillers, not to hesitate. And you can see some bruising around the hip where the surgery has been performed. And within 6 weeks, you'll be seen in the outpatients clinic. And when I see you in the clinic, I would allow them to go back to driving, and also to lie on either side of the hip with a pillow in between the knees, and to go back to swimming. With regard to life after hip replacement, majority of the patients do say that 90% of the pain that they had has gone away, and this would allow the patients to carry out their normal activities of daily living. May not return to active sports, but most of the patients do return to active sports like playing golf, and some of them have gone back to tennis. And the main reason I would ask them to avoid impact activities is because these are artificial joints. They're subjected to wear and tear. And the last thing we want is wearing out of the poly, and the poly debris can contribute to loosening of the hip. So that's what I tend to explain to most of the patients, to avoid high impact activities. And again, precautions to avoid dislocation of the hip: don't bend further than 90 degrees, don't cross your operated leg, don't turn your leg inwards, which can contribute to dislocation. Again, with regard to, you've seen Andy Murray had a hip resurfacing orthoplasty, and he's back playing tennis, and he played nearly 5 rounds in the second round. I mean, it's a shame that we could not see him go through the quarterfinals, but he played great tennis. And again, you can see Arnold Schwarzenegger, again, who had a standard hip replacement at the age of 55. He's still enjoying life, and he got rid of the pain. With regard to the complications that one may come across following a hip replacement, orthoplasty, is one is infection, and I'm proud to tell you that infection rates in Benenden are much lower when compared to any other district general hospital. And also with regard to development of deep vein thrombosis in the legs, sometimes these clots can dislodge and they can migrate into the lung and cause a pulmonary embolus in the lung. And usually when you develop the patient requires admission and anticoagulant therapy. And the other one is dislocation of the hip, and people who do by posterior approach can experience posterior dislocation, where the ball can come out of the socket and cause a dislocation, and either in the front or back, depending on the approach. And sometimes you can have leg length discrepancy, though we try to our best to check the leg lengths during surgery. Sometimes it is impossible to correct the leg lengths because you also got to rely on stability of the hip, and sometimes it's possible to lengthen the hip, but you won't make much of a significant difference up to 2 centimeters, and then on it can be quite painful. And the other thing is there can be slight damage to the nerve or the vessels. Again, it's a very rare entity with regard to developing a foot drop after a hip replacement surgery. When there is slight damage to the nerve, which is mainly the sciatic nerve, it can end up in having a foot drop. Again, it's a very rare entity. And during surgery, one can come across fracturing the femur. If the bones are fragile, there is a risk of fracturing the femur. And once when we come across and when we get into that situation, usually the fractures are stabilized with cables and, if necessary, a plate, uh, and make sure that it is stable enough to proceed on with the surgery. And after a period of time, late complications, one can see loosening of the implant, which nowadays it is not before 15 to 20 years. And if you come across a loosening, then you need to investigate further whether it is secondary to low-grade infection or whether it is secondary to polywear. And depending on that, we do conduct multidisciplinary meetings nowadays, discussed with a number of consultants who are experienced in this field, and we make a plan of how to proceed and how to investigate further and deal with this situation, which would be a revision surgery. Again, I just wanted to let all of you know about the National Joint Registry, and which is there for all of us. It's not only for you, it is also for every one of us to, it is voluntary. If you voluntary to be on the register, it is mainly for the total hips, total knees, total shoulders, and we now have recently introduced for ACL reconstructions as well. The registry will help to find out which are the best performing implants and the most effective types of surgery. And this will also gives for the surgeon how many hips, knee replacements is done, and how many complications he had. And anybody who is an outlier would be flagged up straight to the medical director if there is increased in number of complications for any surgeon. And recording your details enables the National Joint Registry to link people to the implants received during surgery. And if any problem with the specific implant is identified in the future, the NJR will be able to help identify the patients who received it, and your details enable you to participate in a feedback survey, and all personal data is treated as a confidential at all times. it would also be reported to the respective companies if their implants are not performing well in the joint registry, and the NJR chairman will write to them if there are any outliers, either with the implants or with the surgeons. You can review these sites in the public domain, and you can see the surgeon profiles which are available in the public domain, and this will enable you to choose the surgeon who has got good data in the National Joint Registry. In summary, this hip replacement is highly regarded surgery. The main reason for anyone to offer a hip replacement is to get rid of the pain and to improve the quality of life. And as I said earlier, 90 to 95% of the patients are happy that the pain has gone away after hip replacement. It's just not for older people, even young patients who are suffering from arthritic pain, or people who have developed a sudden onset of avascular necrosis following a trauma can be treated with hip replacement surgery nowadays. And you can have your life back. Thank you, everyone, for listening to me and having some patience. And I'll pass it on to Louis.
Yes, thank you for the interesting presentation. We'll just go through some questions now. We have quite a few that come through already. And yeah, let's go for it. So the first one is, they ask, is there a maximum BMI for undergoing a hip replacement at Benenden?
It's a good question. I mean, I'm always very sympathetic for patients who are high BMI, because it's extremely difficult for them to exercise because of the pain, and it's difficult for them to lose weight. So in Benenden, our cutoff is 41 BMI, whereas in NHS, I do up to 46 to 48 is my cutoff. So we do encourage people to lose some weight, to take other measures like seeing the gastroenterologist, surgeons, with a view to lose weight and come back for surgery. The evidence is that people need to lose a little bit of weight, and if they can prove that they can lose at least a stone in weight, it would immensely help that they're determined to lose weight, which would help post-op period as well.
Great, thank you. Next question, would a hip replacement also deal with a history of, is it trochanteric pain syndrome that might have caused a lot of pain in the past but went away, to concealing the deterioration of the hip joint?
There are two different entities, whereas trochanteric bursitis, or what we call it a gluteus medius tendinopathy, is inflammation of the tendon with associated bursitis, which means a bursal sac with the greater trochanter filled with fluid. This is a soft tissue condition and inflammatory condition, and this need to be diagnosed and usually with MRI scans, they're sensitive, or an ultrasound scan. Usually these are self-limiting conditions which can take up to 2-3 years to reach a plateau. But if your symptoms are mainly trochanteric bursitis, my suggestion is not to have a hip replacement unless it has been proven beyond doubt by X-rays and MRI scans that you have got significant arthritis. Otherwise, despite you having a hip replacement surgery, your symptoms may not be totally relieved because your pain condition and source is different, which is a trochanteric bursitis.
Great, thank you. This person says they think they're quite young for a hip replacement and they're in their late 50s. Would you recommend them trying to wait until the pain is unbearable, or should they go for treatment?
If I always tell the patients, if something they can manage by taking some painkillers and some physiotherapy sessions, which may help in the interim, I always ask them to do so. And also it is worth trying a cortisone injection, especially young patients, to buy some time. if all these affect their quality of life and pain significantly, and if they've already been taking painkillers and had all these type of treatments, then I would not hesitate in doing a hip replacement surgery. The youngest patient I've done was in 26 years old. Yeah, I'm still following them up, and had a great result and good pain relief, and he's back playing tennis. And he developed this arthritis when he did a London Marathon, and following that she had avascular necrosis, loss of blood supply to the hip joint, and the hip has crumbled when we did a hip replacement. So if your symptoms are significant, that you've already tried these conservative methods of treatment, and it is reasonable to proceed with hip surgery, provided you got significant bone-on-bone arthritis confirmed on the plain X-rays.
Okay. This person's previously had a knee replacement and asks, is it safe to have a hip replacement on the same leg?
Of course, if you got beyond doubt that your hip is currently getting affected, certainly you would certainly benefit from hip replacement surgery, and there is no harm when you already had a knee replacement that we cannot do a hip replacement surgery. It is quite possible to do it.
Thank you. Are the options provided by Benenden, such as metal, ceramic, etc., the same as the options provided on the NHS?
Of course, yes. We got both ceramic and metal options here. So most of us, we use ceramic bearing because of the long-term survivorship of these implants, and the implants that we use in Benenden have been time tested, and they've got excellent 10 or more than 10 A-star ODEP rating for these implants.
Thank you. How long a car journey is possible when leaving hospital after a hip replacement?
I would always ask them to break the journey if it is more than an hour, so they need to break it after an hour just to have a walkabout and then rest and have a cup of coffee or so, and then get back to their journey. So most of the patients we see, they come from Essex, from Scotland, and from all over the place in UK. So we just need to make sure that they break their journeys every hour or so till they reach home.
Great, thank you. Does your team perform hip surgery using both posterior and anterior approaches?
Majority of our guys, we do posterior approach. With regard to anterior approach, you need a couple of assistants or at least a special table to perform through anterior approach. We do either by lateral approach, which is a hard hinge approach, or a modified hard hinge, which my colleagues, Mr. Srivastava and Mr. Oliver and Mr. Dunnett are familiar with. And rest of us, Mr. Chipfield, Mr. Raman Thakur, Mr. And myself, and we do tend to do posterior approach.
Okay. This person says, would I be comfortable to stand and walk for long periods after they're fully recovered? They used to enjoy long family days out, but can't do that anymore due to hip pain.
Is it after hip replacement or?
Yeah, after. So
yeah,
after they've had it.
Yeah, usually it takes about 6 weeks for you to get back to normal activities. So I would say probably approximately 3 months for you to do prolonged walks and also to get back to your routine. If you want to stand for a long time or go for long walks, that is the time when you can do. But I would always advise to not to fly for at least a period of 3 months because of the increased risk of thrombosis, and you'll be given tablets of anticoagulants for at least 35 days following hip replacement orthoplasty.
Okay, that's sensible. Do you perform minimally invasive surgery at Benenden?
Yes, we do perform minimal invasive surgery. We've got instruments here to perform minimal invasive. The main, the understanding of minimal invasive surgery, your incision has to be less than 10 centimeters. That's what is minimal invasive surgery definition is about. So we can do minimal invasive surgery. We a few surgeons here, where we do not cut the tendons. Myself and a couple of my colleagues who do posterior approach, we do perform surgeries which is called a spare approach and also piriformis sparing. We don't cut the piriformis tendon, we just go inferior to the piriformis tendon and incise the capsule and go into the joint, which in majority of the patients, the recovery is much quicker.
Is a ceramic replacement likely to crack or shatter as opposed to a metal one?
Yeah, that's a good question. It used to crack in the past, but over the years, the ceramics have significantly improved. It's extremely difficult for the ceramic to crack or break, unless there is a malalignment in the hip or so, and which would crack. And now the ceramtechs have significantly improved the quality of the ceramic, so it is very difficult for the ceramic heads to break.
Okay, just a few more questions now. We're asked, do you need an MRI to prove osteoarthritis or just x-rays?
Majority of the cases, we tend to rely on x-rays. If the x-rays do not show any evidence of arthritis, then if pain is still in the groin, then we tend to get an MRI scan to see whether there is significant marrow edema or whether it is related to femoroacetabular impingement. Sometimes there can be impingement in the hip, which can be diagnosed with an MRI scan, and along with contrast would especially help in diagnosing labral tears. That's why I normally ask, if the plain x-rays do not show any evidence of arthritis, then I'll be thinking of a differential diagnosis and asking for an MRI scan with contrast.
Is there any way to prevent hip arthritis getting worse before considering surgery?
Yes, certainly it can help. I mean, one is losing weight, not to put on any weight, and also healthy diet. And if there is a strong family history, at some point you're bound to get it. And also high impact sports. Again, it's good for your heart, and running and all these things are good for your heart, bad for the joints. In the long time, people may suffer from arthritis. So again, just doing in moderation would significantly help. And again, some anti-inflammatory, the National Diet Federation have time and again have advised that nightshade vegetables are bad for the joints, as they tend to cause inflammation, and also supplements like glucosamine sulfate would help, and turmeric, and they also suggest that pineapple fruit is the best for reducing the inflammation.
Okay, thank you. You mentioned only going outside after 6 weeks, so is it recommended to stay indoors for the first 6 weeks?
No, I mean, you can walk in moderation up within 6 weeks. It's basically developing your confidence and walking. So as long as you've got confidence in walking, first I would suggest is indoors to walk without the help of any walking aid. Once you're able to manage indoors, then you can go for short walks up to 6 weeks. Then after 6 weeks, unless there is some restriction, nothing stops you from going.
Wonderful. And our last question is from John, and he asks, can you cycle after surgery, or does the angle of the hip exclude that activity? Also, is jogging and other impact exercise discouraged?
I would encourage people to go for cycling. After a period of 3 months, they can get back to cycling, and also gentle jogging if they wish to. Again, one has to remember that these are impact, and as long as it is gentle, it would not create tremendous stresses on the joint. One has to remember these are artificial joints, which are again subjected to wear and tear.
Lovely, thank you. We do actually have one more, which we'll just go through, and then any others we'll just message you afterwards with any answers. But Susan asked, what painkillers would you recommend for hip pain? If on them long term, can you get addicted?
Yes, opioids can be addictive, and the best person would be your GP who knows your history. So I would suggest to ask a GP for some simple painkillers. But again, anti-inflammatories have got detrimental effects on your stomach and also on your kidneys. So I would suggest to take them with caution, and also speak to a GP who would be the best man to guide you with painkilling medications.
Wonderful, thank you. Okay, I think we managed to answer everyone's questions this evening, so that's really good. Yes, I think that's really good. So if you would like to discuss or book your consultation, Chelsea from our private patients team can take your call this evening until 8:30. And she and the rest of her colleagues are available 8 AM to 6 PM Monday to Friday using the number on your screen. We're offering a discount for joining the session for the next 7 days with the terms displayed. After we finish this webinar, you'll receive a short survey, and we're really grateful if you could spare a few minutes to let us have your feedback, as it helps influence our future events. Our next webinars include varicose vein treatment, gynecology, and knee replacement surgery, and you can visit our website to sign up to these. So on behalf of Mr. Kumar Reddy and our expert team at Benenden Hospital, I'd like to say thank you for joining us today, and we hope to hear from you very soon. So thank you very much and goodbye.
Thank you.